post-cabinet press briefing. I am Press Secretary Philomena Robertson. We do apologize for the late start this morning, but we are happy to finally get on the way. This morning, we will, of course, be continuing our conversation about the COVID-19 pandemic. As you would have seen from the GIS release, we were scheduled to have Dr. Darlin Nwell this morning. However, because of a number of admittances at the General Hospital, he has been called away to duty, so he's unable to join us. But we do have Dr. Molara Alexis, who is Grenadian, currently based in California, but she has joined us here to help with the current crisis that we are experiencing. And we also have Karina David, who is a primary care physician, also Grenadian, from Indianapolis, based there now, and she is also here helping us through this crisis. So we will get to them later on this morning. But first of all, we have the Prime Minister and Minister of National Security, Dr. the Right Honorable Keith Mitchell, who has joined us very briefly this morning ahead of a UN engagement later today. Dr. Mitchell is here to give us a quick opening statement. He will not be able to stay for the full press briefing, but he thought it important to show his presence here this morning to share a brief statement with the nation. Dr. Mitchell, good morning.
Thank you, Philip. Thank you, Philomena, and to all our brothers and sisters of the media, and of course, our medical people here with us, Dr. Alexis, Dr. David. I want to thank you all for your presence here this morning. And first of all, I'm here primarily because of, as we are aware of the seriousness of where we are today in terms of the problems that we're facing with COVID-19, and the fact that so many of our people are making enormous sacrifices and commitment, and I felt it was necessary at this time to give some commendation to the persons who are continuing to be at the forefront of the fight and support system. It's always good. Today we have in the medical people. It's always good to have the medical people doing more talking than the politicians like myself and other ministers, because they are the ones that facing the difficulties and the problems in a direct sense. But I do want to commend both ministers of health, Mr. Steele and Minister Delma Thomas, for the enormous commitment and hard work that they have continuously put into this whole control of the COVID-19 pandemic that we are facing. And in particular, additionally, remember Minister Thomas is also Minister of Social Services. In effect, she is having to do literally two work as a minister. So in that sense, even a special commendation to her and her team in both ministries. I thought it's important to mention the fact that the CMO and all the medical personnel, I have had the opportunity to have some special session on Zoom with many of the medical people, and it was to me one of the highlights of my interaction so far. The fact that I was able to talk to them personally and for them to ask questions directly about what is taking place, and they offer suggestions. So I was not hearing it from a minister; I was hearing it from those on the ground, so to speak, and it was one of the more illuminating time, because the nurses had over 4 sessions with different groups of nurses because they work different times. So last week I've been extremely busy with Zoom session one after the other. 3 sessions, 3 different groups of doctors, and in fact we will be talking to those serving in Karaku also separately. So I don't want to commend all of them for the efforts. This is a tough time emotionally, psychologically for everybody, including myself, and watching what is taking place. But we also must recognize the nurses, the orderlies, the maids, and all the workers in the hospital. Sometimes we think of one group of people and we forget that we need everybody in this fight that we are in. Because as I was saying to a particular group of persons yesterday that I had the opportunity to be on more on the churches, commit churches, friends of mine, I said, look, in this fight, we need everybody, and we can't marginalize any person, because let's face it, if the people who clean the streets are not out there doing their work, the fight with COVID-19 would be far more difficult. So we have to recognize those persons that are out there in the streets, cleaning the streets, because sometimes, because based on the category and how the society define them, they're lowest of the low, so to speak, but they're not the lowest of the low. They are as important as the Prime Minister, or as important as every doctor, every nurse outsider, because their work will be a critical component in the control of the problem that we're now facing. I want to also thank the community health persons, the staff at the clinics who are out there. I know some of them have got infected. I personally experienced this because one of the staff at the medical station in my own area got infected. So I know the contribution that they're making and the fact that they're risking their own lives and that of their families in the process of protecting us. And one of the things I've learned in talking to people around the country as I go around and I'm in touch with people about various constituencies, I try my best to make contact not just with the persons on the front line. And one of the things they mention is the fact that the sacrifices they see that the health workers are making touch them a lot. And they also believe that we as a country and a people need to do probably even more in ensuring that we take the guidelines that are given and use it effectively to reduce the level of the work that the frontline workers have to endure. I also want, like at this point, to say to the families, it's one of the most painful part of this. For me, emotionally and otherwise, is the continuing deaths of people. This is touching. We can't go back to where we were before. We have to be where we are now. The fact is, a lot of innocent people are going down. And especially the people at age groups, who generally speaking are not necessarily the ones that have been out in the streets, but they're the victims directly, so most of them are. So I want to say to them on behalf of the government and people of this country, I empathize and sympathize with their loss, the families. So every family is the loss of someone, loved one. And I myself have been seeing it in friends of mine. When I receive reports, it touches me very deeply. And it's something I don't believe we'd ever be able to come to terms with as a human being, the passing of any individual, particularly when it could have been avoided. So I think I want to take this special opportunity to say how touched I am, and the fact that we're doing all that we can to be able to slow and stop the deaths that are occurring in the country this time. I'm also heartened to note the fact that we're seeing a drop in the infection rate, which is a good sign. But that by itself does not mean that we could drop our guard, because we can see the drop today and we could be back up tomorrow if we get complacent and feeling of course that line. Then we go back and do things that can cause problems. Then we could go right back up again and further cause problems for all of us. I want to say also the efforts of the vaccination and testing that's going on around the country is, to me, heartwarming, because I witnessed it on Sunday in my own constituency, where a number of workers from all sectors of the society came out to help in my own area, and the doctors and the nurses and the almost total commitment that I saw there really made me feel good. And I know Minister Boyne and other ministers have expressed the same thing whenever there are issues and initiative outside in the communities. They certainly have, in fact, felt that today these workers are giving more than that we could even expect. In going forward, one of the things that also touched me is the fact that I've seen a number of photos of individual citizens sending out that is talking about advising and calling on elements in their own sector of services to follow the protocol. I saw one by a busman that I thought touched me, where he was advising all busmen to observe the protocol, wear your mask, insist on anyone coming the bus, into your bus, that they must wear a mask, and not just pretend to have a mask, wear it properly. Make sure that you have sanitizers in your buses. A number of business persons have been offering and giving sanitizers and other materials that can help protect persons. In other words, even if one takes a bus or some facility where someone might be positive, and you protect yourself properly, wear your mask. That's not asking too much. Protect yourself. Even if you come in contact with that person and you're properly protected by observing the protocol, then you still have an excellent chance of not catching this virus. So I think the emphasis must also, I know there also the debate on the question of vaccination. You know, for me it's not a debate. To me this is so clear. This is so clear. I can't understand how anyone cannot understand the clarity of this. If you have a situation where an action is taken, something is wrong like this virus, and you've seen the statistics so clear, where you see over 99% in some countries, and the lowest I've seen so far about 97, but that statistics is extremely high. Persons that are dying from this COVID-19 are unvaccinated people. My God, what else do we want? If you hear some stories about some unvaccinated person die or got sick with a virus, that's very small. It might be 2% you're talking, or 1%. My God, be on the side of the statistics. That's what I will do, and so on. So I'm urging people, all our citizens, to to do what they have to protect. This is about one's own life, one's family life, and so on. I do want to take this opportunity to commend a number of businesses and other people in the country, the hotels and service providers, restaurants, service providers who are offering help, offering to provide food, offering their hotel space for people coming in to help us. I've seen that, and therefore I want to commend the Hotel Association by Mr. Leo Garbett and all his team, and the Hotel Association and others, all of them, for making the sacrifices that we need. Everybody in this battle that we are facing in this time. I want to commend my dear sister, Dr. Alexis. She happened to be Dr. Francis Alexis' daughter, and Sir David, and all the other doctors. Minister have spoken about a few others before. But you know, the fact that you've left, and you know, I wish others will take a page from your guys' book. We've trained hundreds of doctors in this country. The country needs us. It makes sense, all of us. I have called on family members with their nurses and so on. Come on, give her 2 weeks. We need you. Your country needs you. We need everybody to come at this time. The community centers need, facility clinics need all to be opened so that people can get the service when they need. The nursing staff is overstretched. They cannot man every facilities outside there. So the more we cooperate, the more we help them, help ourselves really, the better for us. I don't think we need more pleading to do what we have to do to protect ourselves. I'm confident. We have passed through many storms before. This is probably the biggest storm, because no country has ever had to deal with a virus, a pandemic that engulfed the entire society, which is what all countries in the world are facing. But those who have vaccinated, those observing the protocol, you notice what has happened? I'm watching Premier League football now, and you see over 60, 70,000 people. You know what happened? Each one of them must show their vaccination card over there. And you're not hearing any major problem. It tells you that if we do what we have to do, we'll be back again on the cricket field and the football field, and we'll back again doing the things. And the jab session will come whenever that time comes. It will come. We all want to do our own thing as we want. Why not? Because we must do that. We have to live. So all these sessions will come. But let us do what we have to do now, control this thing, and we're back to where we want to do. So I'm confident that we will get through this. We have, as I said, weathered a lot of storm in the past. When Ivan came, people thought we couldn't recover. We did it better than faster than most countries would. The Grenadian people are very resilient, strong, and I'm sure that with that, our commitment and what we are seeing from our people, that we'll go through this. Friends, therefore, I want to thank you, and I want to thank our doctors for in this session. As I said, sometimes they hear only politicians. We don't want a politician all the time. We want to hear the people on the ground. That's what I want to hear, and I think that's what people want to hear. So, I want to thank you all. For those of you listening, this is not my post cabinet. This is the professionals' post cabinet. So I want to thank you for the effort. My dear Sister David and Dr. Alexis, Sister Dr. Alexis, I want to thank you. And guys, take care. I might catch you, some of you while heading to where I'm going to my next meeting. All right, thank you all.
Thank you very much, Prime Minister, for your presence here this morning and for the words of encouragement to the nation, for your words of gratitude to all of the persons who are involved in this fight, and your constant plea for us to stand together as we go through this pandemic. Thank you again, Prime Minister. Ladies and gentlemen, we'll take a quick break, and we'll be right back with the rest of the panel for this morning's post-cabinet press briefing. We will also have a joint statement from the religious community, and that will be delivered to us by Reverend Silbert Prescott. So we'll be right back. Please stay with us. Good morning again, and thank you for staying to the continuation of this week's post-cabinet press briefing. For those of you who just joining us, we had the Prime Minister delivering a brief statement, words of encouragement to the nation, and also an appeal, for nurses, doctors, members of the medical profession to help the country in this time of crisis, and the fact that, we should all be working together. Continuing with the program this morning, I have with me now Doctors Karina David and Molara Francis, who are both Grenadian, but they're based overseas right now, but they have come back home to assist in this particular crisis that we're facing right now. Before we turn to them, however, I want to invite Reverend Silbert Prescott. He will deliver a joint statement from the religious community, and that statement speaks to new arrangements for funerals that will go into effect this week. Reverend Prescott, good morning to you. Reverend, you're still muted. Please unmute your mic. Yes, there you go. Good morning, Reverend.
Good morning, Ms. Robinson, and greetings to the media and to all our listeners. I'm going to read for us at this time a joint statement by funeral directors and the religious community with the concurrence of the government of Grenada, dated 27th September 2021. Despite the losses we have experienced at the death of so many cherished ones in our communities, this pandemic has demonstrated the heroism, self-giving of persons who have put service before self and the greater good before perceived prerogatives. Our nurses, doctors, administrators, persons in uniform, and funeral directors, clergy persons, and numerous others continue day after day to protect and preserve life. And where that has not been possible, to provide compassionate and dignified post-mortem care of the deceased and the sensitive ministry to the bereaved. We need to show our appreciation for all that they have been doing and continue to do by ensuring that, as much as it is within our power, we keep them safe. Our clergy persons, funeral directors are often the last ones to care for the deceased. Every time we have a funeral, regardless of whether that person has died from the COVID-19 virus or from other non-infectious causes, the gathering of persons, often in a heightened emotional state, puts funeral directors, clergymen, and those attending the funeral at risk. We are told that the possibility of the spread of the virus decreases in open spaces as opposed to indoor environments. It is for this reason we have made the following decision as a follow-up to last week's joint statement from government, funeral directors, and the religious community. And I quote, "All funerals, whether they are persons dying from COVID-19 virus or other causes, will be held at the cemetery and shall be for no more than 20 persons and for a duration of not more than 1 hour," unquote. That brings the statement to a close at this time.
Thank you very much, Reverend Prescott, for sharing that joint statement from the religious community, the Ministry of Health, and by extension, the government of Grenada. Thank you very much. I now turn my attention to the two doctors who are here with me. Dr. Alexis, I think I do have to apologize. I may have mentioned you as Dr. Francis, thinking of your dad. So if that was indeed the case, my apologies to you. But welcome, ladies, and thank you so much for joining us this morning. I'll ask you, first of all, to introduce yourselves. Tell us a little bit about your background, where you from, where you in terms of where you're working now, and the experience that you've had with the pandemic, and what has motivated you to come to Grenada at this time. So I'll start with you, Dr. Alexis, and then Dr. I'm sorry, Molara. Can I just call you Molara?
Just call me Molara.
That will be easiest.
That
yes.
works well. Thank you so much. I'm grateful for the privilege to come on this forum and just to share. Just briefly, as was said, I'm Molara Alexis. I'm trained in internal medicine at the State University of New York, Brooklyn, New York, and at Henry Ford Health Systems in Detroit, Michigan, infectious diseases. I went to our own school, St. George's University. I presently work as an infectious disease physician in Southern California, and I have been in this fight against COVID since this pandemic began last year, 2020, around March. So I've been to a couple surgeries. We had one there in the summer, around the summer, and then the one that was, I guess, the hardest hit for us was the December, January, February surge that we had. And coming out of that experience, I've learned a lot, and Grenada is my home, and I wanted to be here to just support the healthcare workers during this very terrible time, to let them know that, you know, you are not alone. We are here to support you however we can, and also to provide whatever support I can to the healthcare workers here in our beloved Grenada, Carriacou, and Petite Martinique. I do not speak on my own behalf, but also on the behalf of the other medical professionals in the diaspora. We have a group, and some of our objectives, briefly, I would be remiss if I did not mention these are the doctors and other healthcare professionals laboratory professionals, and right now they are working on raising funds, on providing education, on providing telemedicine like backup support, and also as is possible to come to the ground to support the healthcare workers. So it's a privilege for me to be here, but also I want to let you know that there are other people who are not here physically who are working on getting resources together, raising capital, providing support to the healthcare workers on the ground. Grenada, you are not alone. We are here in this together with you.
It's certainly heartwarming to hear that, and thank you so much for your presence here and for helping the country at this time. Dr. David, over to you. Similarly, share your medical experience and what motivated you to join us here in Grenada at this time.
Thank you. My name is Dr. Karina David. Thank you so much all for having me. It's an honor, a privilege to be here along with Dr. Alexis. A little background, I proudly trained in medicine at St. George's University, also a daughter of the soil, a Grenadian. I went on to do my family medicine residency in Indianapolis, Indiana, at Indiana University Health. I have been practicing there as a primary care physician since about 2016. Like Dr. Alexis, we have struggled with the coronavirus pandemic. We have been through, I would say, about 3 waves right now. The first, as everybody already knows, in the spring of 2020. Then we were hit again around November 2020, and that lasted solidly throughout the winter until about January, February. And then again, most recently with the Delta variant, Indianapolis, where I practice, has experienced another insane surge due to the Delta variant. Thankfully, we seem to be calming down with that right now. In my practice, so I work in a primary care practice. It is based in a university hospital. So I have quite a diverse patient population, high-risk patients, organ transplant recipients, and so on. And also I work near a university campus, Indianapolis University. And so I see a lot of young, healthy patients as well. So a wide array. So I have quite a bit of experience with how COVID affects a broad spectrum of patients. And I'm happy to answer any questions that we may have regarding that. And as Dr. Alexis mentioned, I have to thank the diaspora, the group of physicians who we have been working with, spearheaded by Dr. Michelle Friday, Dr. Lisa Radix. They have been instrumental in getting us here today. They are working tirelessly behind the scenes to provide as much support as possible, and it's really admirable what they're doing.
Thank you, Dr. David. So a question to both of you. Now that you're here on the ground, you've experienced the waves in the United States and the respective states in which you live and work. What is your primary message to the people of Grenada at this time?
I'm here this morning just to say that vaccination is the way that we're going to get out of this pandemic. Our last wave, December, January, February in Southern California, I mean, the hospitals were just overflowing, in some areas, particularly in Los Angeles County, we are housing patients, out of hospital rooms, places where people normally don't stay as a patient, but because they were overflowing, that's where they were. But then just after that period, December, January, that's when vaccines came out, and then we saw a steady decline until we went down to just very few cases. And then here comes the Delta variant. But what I have personally seen with my eyes is that the patients I am admitting, or the patients that I have admitted to hospital, particularly those who are severely ill, are the ones who are unvaccinated. We do understand that there are breakthrough cases, and yes, I have seen, partially vaccinated people come to the hospital. But in the majority of cases, the people who are admitted, struggling to breathe, requiring a ventilator, going to the ICU are unvaccinated patients. I'm seeing that. I saw that in California. This is what is happening in Grenada as I follow what's going on, as I speak with the doctors, Dr. Noel, the other personnel at the General Hospital, as I read medical literature from New York. There was a big study coming out from MMWR, that's Morbidity and Mortality Report from the CDC, and it talked about people who got vaccinated in Los Angeles County. And the vast majority of the people who ended up in the ICU, who were hospitalized, they were unvaccinated. Again, there was a similar study in New York. Again, it's the same thing that we have. On a previous forum, I quoted figures from Myanna, Jamaica, the University of the West Indies, where the authorities there were pleading with the people to please be vaccinated. They were saying they were at capacity, and about 96% of the people who were coming to the hospital were unvaccinated. This is happening everywhere, so vaccination works.
Thank you, Dr. Alexis. Dr. David, anything you would want to add to that in terms of your message to Grenadians at this point?
I certainly share the same sentiments as Dr. Alexis. It is the same thing that I am seeing in my practice among young, healthy individuals, among older, sicker individuals, young, sick individuals. It stands true across all populations. Our vaccinated patients just tend to do better. If you're vaccinated, God forbid you end up in the hospital, you just tend to have a shorter, easier course. We see a lot less ICU admissions, a lot less intubations. We know that our vaccinated population just tends to do better. It is, as Dr. Alexis said, the same thing that we are seeing here in Grenada. It just tends to be that the unvaccinated individuals just don't have great outcomes. It's quite disheartening to see, we have an answer to this pandemic. We have a potential cure to this pandemic. Often we hear individuals talk about, why would I get the vaccine if you can still get COVID if you get the vaccination? The purpose of this is to lessen the impact, lessen the economic impact, the public health impact. We want to see COVID be something more like the common cold. You get it, you get over it. It doesn't have to be a big thing. It doesn't have to be such a burden on society. We don't have to bury our aunts and our uncles and our cousins. And when we have a large subset of the population vaccinated, that's just what we see. The burden is so much less. And so I implore everyone, the vaccine has been proven to be safe. It has been proven to be effective. All of the studies that have been resulted and are still ongoing, the results seem to be the same thing. The vaccinated population just tends to do better. I understand a healthy level of skepticism. That is completely normal, completely expected, but I ask that you trust in your healthcare professionals, you trust in your community leaders. We're all asking you, pleading with you to please get vaccinated, and we'll see better outcomes.
Thank you, Dr. David. Dr. Alexis, before we entertain questions from the media, I just have one other question for you. You raised the subject of comorbidities, and we've seen that as an issue for us here in Grenada. What can you say to that?
There is a false notion that, if I have certain comorbidities, I cannot get the vaccine. I was at the Grand Mall vaccination clinic on Sunday, and several people had, questions along that line, can I get the vaccine? And not just there, in my interactions with people. So actually, people who have, and when we say comorbidities, we're talking about chronic illnesses, like locally we call it sugar, diabetes, pressure, hypertension, heart disease, like heart failure, coronary artery disease, commonly known as you had a heart attack. You have lung disease. Unfortunately, we're having a rise in renal or kidney disease. Asthma, that's another common misconception. People with asthma, a liver disease, saying, I don't want to take the vaccine because I'm complicated by this. As medical professionals, we are saying that if you have these comorbidities, sugar, diabetes, pressure, hypertension, this is just the common way we call it. If you have chronic lung disease like asthma and emphysema, if you have heart disease, another one is sickle cell. It's common here in Grenada. These comorbidities, these illnesses, put you at higher risk for getting a severe case of COVID. And it is essentially because you have these that you should be first in line to get the vaccine. So as a medical doctor, as an infectious disease physician, I am here this morning to say that diabetes and high blood pressure, these comorbidities, they are not a reason for you not to get the vaccine. Some people think that it may interfere with my medication for these diseases, that is not correct. So I'd also like to emphasize that people with these comorbidities should really get the vaccine, because the vaccine actually reduces your chance of getting severe COVID, and it does not make your diabetes worse, it doesn't make your asthma worse, it doesn't make you go into a sickle cell crisis or things like that. So please, people with these comorbidities that I have named and others, go right ahead. Also, people who have a weakened immune system, for example, HIV, or maybe cancer, or you're on maybe you have lupus and then you're on a high dose of steroids and methotrexate. Again, this is not a reason not to get the vaccine. Granted, you may be taking a medication that may affect your immune system, so your physician would give you the best time to take the vaccine. But even with your cancer patient, you're on chemotherapy, your doctor may advise you, okay, do it in such and such a time. But again, people with cancer, HIV, people who have autoimmune conditions, these are not reasons not to take the vaccine. We stand here as a medical community to say that. Also, I'd like to give a word on pregnancy, but I don't want to do all the talking, so I'll just stop here.
Okay, Dr. Alexis, thank you very much. Members of the media, the floor will now be open to questions. I see we have a number of journalists present this morning. Mikey Hutchinson, we have MTV, GBN, Nancy McGuire, Calista Faria. Okay, I just saw a note from Mikey that you have questions. Mikey, please proceed with your questions. Good morning to you.
Good morning. I noticed Calista was up before saying that she had questions before me, so I don't want to create any issue with that. But doctors, good morning. It's a pleasure to have you on the panel this morning. One of my questions is in relation to pregnancy as well, and nursing mothers and vaccination, and whether or not nursing mothers should consider being vaccinated, or should they wait a while, or should they have any concerns on what these concerns might be. As well, other than the fact of vaccination, which we talk about quite a bit, I noticed that the death to infection rate in Grenada is pretty high. Have you been able to at least determine why so many Grenadians are dying from COVID-19?
Good morning, Mr. Hutchinson. So I can speak to your question about pregnant and lactating mothers. 100% yes. We do recommend that pregnant women and lactating women get the vaccination. In fact, pregnant women, they stand to have higher rates of complication from COVID-19. And so yes, if you are pregnant, we implore you, go ahead and get the vaccine. It is safe, it is effective in pregnancy. In fact, your risk of complication from COVID is so much higher than your risk of complication from the vaccine. As it stands to nursing mothers, yes, we 100% recommend vaccinations in nursing mothers. In fact, I was nursing my 4-week-old infant when I got my first dose. He was about 12 weeks old when I got my second dose, and still nursing him. I got my booster last week, and he is still doing well. So I definitely recommend it to everybody.
And if I can add to that, people like to know, numbers. Again, the New England Journal of Medicine, they had an article where they looked at a little over 35,000 people who were pregnant who received the COVID vaccine, mRNA vaccine, of which Pfizer is one, and there were no safety signals, meaning they did not see anything that would indicate that the vaccine causes like abortions, spontaneous abortions, preterm labor, or something like that. There was another study done by St. George's University, not our St. George's University, but the one in London, United Kingdom, and they were able to say that after looking at the women who got these vaccines, the mRNA vaccines, particularly a small percentage AstraZeneca, there was no increased rates, for example, of stillbirths and fetal abnormalities. So again, it is not a live vaccine. For example, the measles, mumps, rubella vaccine, that's a live vaccine. You're not going to give it to a pregnant woman. But these vaccines that we are offering here, the Pfizer and the AstraZeneca, they are not live vaccines, and thus I agree that vaccination is safe in pregnancy and breastfeeding. As a matter of fact, breastfeeding women have antibodies in their breast milk. And so antibodies are proteins that the body makes to protect the body from the virus. And so these may be of benefit to the baby. So again, we encourage breastfeeding women and also pregnant women to go ahead and get vaccinated. To answer the question about why so many Grenadians are dying, I'm sure there are other things that could be added to this, but one thing that we are seeing is that many of these people unfortunately have risk factors, such as diabetes, high blood pressure, some asthma, and some are elderly. So this can contribute to a high death rate. The rate of comorbidities such as diabetes, high blood pressure, asthma, that could contribute to that. And this Delta also, it appears that it may be a little more, may cause a little bit more severe disease. So these are two things that can help to explain. There may be other things that can be added to this answer, but these two things, comorbidities such as diabetes, high blood pressure, asthma, and age, and also the severe disease caused by Delta may also be an answer to that.
If I may also add one more point, one thing that we have been noticing, myself and Dr. Alexis, in speaking with Dr. Adal and Noel at the hospital yesterday, we see a lot of people coming in when it's too late, when they've been infected for too long and they've gone into multi-organ failure, they've gone into the end stages of the disease. So we implore you, if you're at home, if you're feeling ill, please call your healthcare professional. There may be interventions, there may be steps that we can take before it is too late. So that can certainly be contributing to our high death rates as well.
Okay, thank you for those responses. Callistra, sorry that I seem to have missed your note in the chat, but I'll come to you now for your questions, and then we'll go to Nancy McGuire. Callistra, go right ahead.
Good morning, doctors. Have you, Dr. Alexis in particular, have you had a chance to review the data regarding our infection rates now, and what is your assessment of the direction that the outbreak is moving? The CMO said recently that we could be seeing a slowing down of infection. The numbers we are seeing now, is it related to actually a slowing down, or is it a situation where we are not testing sufficiently? And also, what is your assessment of the measures we made? I'm sorry, just one. What is your assessment of the measures which Grenada has in place for the treatment of patients with COVID? For Dr. David, is there any prophylactic treatment for COVID-19? And is there any reason, we've given a lot of reasons why we should be vaccinated. Are there any specific reasons, any specific group of people who are to be advised not to get vaccinated? Fear of vaccine anything.
Thank you very much. We are grateful. I spoke to Dr. Charles, CMO, acting CMO today, and from the data that he showed me and my discussion with him, the positivity rate is decreasing. That's meaning that the number of cases are declining. So that's good. I do want to say that when we see that, this is more reason for us to keep doing what we're doing, because the virus that causes COVID-19, because it can cause variants, we don't want to say, well, okay, we are getting through, things are getting better, so we don't need to get vaccinated and so forth. No, now is the time to even ramp up our agenda in getting vaccinated, because sometimes down the road we can have another variant, and if we are vaccinated, that increases our chance of being protected. So although the rates, we are seeing a decline, and we hope we are going down the mountain, continually down the mountain, now is the time to continue the vaccination drive, because down the road we may have another variant, and this vaccine would help protect us from the Delta and hopefully from other variants in the future. So that's the answer to that. And then the second question, I think I didn't remember it.
What's your assessment of measures that are being used to treat COVID-19 patients in Grenada?
Okay, thank you. So dexamethasone is one of the medications that came out of the recovery trial as something that could reduce morbidity and mortality in patients with COVID-19. We are grateful that dexamethasone is a drug in good supply here in Grenada, so we are grateful for that. Some of the other drugs which may be useful a little earlier, at this moment, They are not here on the island. But despite that, we have dexamethasone, which is actually a very good drug. The physicians, the nurses are doing a wonderful job in also recognizing other infections that could also happen with COVID-19, and they are treating them diligently. They are doing the proning, which also has been shown to assist and help. So I think that based on what we have here with the Decadron or the dexamethasone, the physicians and the nurses, they are doing the best that they can, and they should be commended for what they're doing to be saving lives here on the Tri-Island state.
Dr. David, I think there was a question specifically directed to you.
Yes, I believe you asked about prophylactic measures, prophylactic treatments for COVID-19. So that's medications that we can take to prevent it. Unfortunately, now we do not have any medications available to prevent COVID-19. We do, however, have the vaccination, which has been proven safe and effective. We know that patients who are well physically just tend to do better if they do get COVID vaccine. If they do get coronavirus, so we always recommend, healthy diets, regular exercise, and so on. In my practice, we do use a monoclonal antibody. I know several members of our group have been trying tirelessly to get the monoclonal antibody for early COVID-19 treatment. Unfortunately, that is not available outside of the US as yet, but we are still working to get that. I'm sure we will provide updates as we can. I believe there was another question for me.
I didn't get another one, but maybe we can go right back to Kalishra. Kalishra, do you have another question for Dr. David?
The question I had asked was, are there any reasons, there are a lot of reasons that have been presented for taking the vaccine. Any specific reasons, any specific groups or people affected by anything in particular who ought not to be vaccinated for fear of vaccine injury?
Thank you. That's an excellent question. So the only patient group who we have unanimously recommended against getting the vaccine were patients who had a strong anaphylactic response to the first dose of the vaccine. Or patients with a strong anaphylactic response, that's a severe allergic reaction, throat swelling, face swelling, problems breathing, and so on, to any of the vaccine components. That is exceedingly rare. Seasonal allergies, food allergies, other medication allergies, that is not a reason not to get it. Illness, as Dr. Alexis said, not a reason not to get it. Really, the only unanimous thing that we stand behind is if you've had a severe anaphylactic response to the first dose of the vaccine. I believe Dr. Alexis can expand on that if I'm missing any pointers there.
Yes, that's correct. If you have a severe allergy, not like, an itch or a severe, like your lip, a swelling, you feel tightness in the throat, a severe. Also, if you have an immediate response to the first dose, like within 4 hours you get an immediate response there, that's also one. But again, these are not some things that happen very often. They're very rare. And so we just want to emphasize that. Again, some people say, well, I'm allergic to metformin, I'm allergic to aspirin. That is not a contraindication. That is not a reason not to get the vaccine. You can mention that to your provider, but that's not a reason not to get the vaccine.
Nancy McGuire, you may proceed with your questions. Good morning to you.
Good morning, and good morning to the doctors. I'm glad that you made it clear that people with these conditions, like a heart attack or asthma, should still get the vaccine, because that seems to be one of the reasons that people come up with when they're hesitant. But I'm wondering too, in your practices in dealing with people that are hesitant, how much time do you need to spend, like on a one-on-one conversation, to convince people to take the vaccines that are just afraid? And secondly, I wonder if you could speak to the vaccines for children and the possibility of boosters. I think it was Dr. David say she just had her boosters. We're not even talking about boosters here in Grenada. So you could make some comments on that. Thank you very much.
Thank you very much, Ms. McGuire. So how much time it takes, it just depends on a person's comfort level. I've had conversations with people in this country and where I also work, and it just depends on how comfortable they are. Sometimes I have one conversation and that's okay to convince someone. Another time you have to keep, repeating and talking and sending articles and showing. So different people have different comfort levels, and we understand and appreciate that. So to answer the question, it just depends on person. Some people with one conversation it works, other persons it takes more conversations and sending some other support information. As regarding boosters for children, so far what we do know regarding the Pfizer vaccine, that a booster dose has been authorized. Well, first of all, I should say a third dose we know has been authorized for people who are, immunocompromising conditions. These are persons who would not, it's thought that they would not mount an adequate response with just 2 doses. So a third dose has been authorized for such persons. Now, for the other members of the population, after looking at it, it has been put forward that people who over a certain age, over 65, a booster dose is recommended. Persons with certain medical conditions that would put them at high risk, that's also recommended. And also the CDC director also added to that people, for example, who work in healthcare settings would do well from a booster dose. So far, these are the recommendations. We have no recommendations for outside of that at this time, and so as time goes on, I'm sure we'll get more information.
Yes, I was lucky enough to be among part of the first cohort to get the Pfizer vaccination in January. Hence, I was about due for the 3rd dose. And with working in healthcare, with working with a high-risk patient population, I thought it very beneficial for myself and my patients to protect all of us. And so I went ahead with that. In Grenada, the vaccine was offered just based on availability a little bit later, so we're not quite up for that. So information will be forthcoming, hence no boosters here as yet. In terms of, apologies, what was the other question?
The other one spoke to dealing with persons who are hesitant.
So similar experiences with Dr. Alexis. In several patients, it just takes one conversation. They just wanted to know that, yes, I recommended it. Yes, I think it's safe and effective. And that was it. They went out and got their vaccination. In other patients, they have a healthy degree of skepticism, so it takes several conversations over the course of several weeks, several months, and then they go ahead and they get it. I do have a small population of patients who are still holding out. They want to see more safety data, but in every conversation, I do provide reassurance and I do provide encouragement. I think it's important that patients get it on their own accord, that patients feel that it's safe, that they feel that it's effective, and that they want it. And so we encourage them in that way every day. We'll do whatever we can to make sure that they feel confident in this vaccine.
Thank you. Janella Holston, MTV. Go right ahead with your questions. Good morning.
Good morning. My question is to either of the doctors. There appears to be some inconsistencies. I'm not sure if you'll be able to respond to it or how well, right? But based on your experience, I'm seeing here now that there appears to be some inconsistencies with the testing in terms of, we have people testing positive today and then they go to another facility and they're tested again and it returns as negative or vice versa. In your experience, what do you think may attribute to this happening?
Thank you for the question. So this sometimes happens. For example, I may have a patient test positive, or for example, they test negative, and with the symptoms they describe to me, it sounds so much like COVID. So we repeat the test, and it's positive. So sometimes that may happen, depending on how the test is taken. So that's one thing that may happen. I'm just speaking in general as to why we have this phenomenon, not into a particular case at this time. So that's one thing. And then we also have this happening. For example, I'm diagnosed with COVID now, and then 4 days later it's negative, and then you get this kind of flipping positive, negative, and sometimes that confuses individuals, particularly for people who have recovered. And I see it all the time. A patient diagnosed with COVID today, 10 days later the test negative, and then 15 days the test positive, and sometimes the test flips positive to negative. So this is something that commonly occurs, and it's not to say that the patient had COVID, then they didn't have it, then they got it again and negative. It's not like that. It's just a phenomenon that occurs, and it may have to do with the viral load and things like that, but it's not in that case has something that has to do with the testing itself or the quality of how the test was taken. So in sometimes it may have to do with how the test was taken, and there are other instances where we just see people test positive, they test negative, particularly after they recovered, and this is something that happens, and we don't. That's why again the CDC doesn't recommend retesting after a patient has recovered. If 10 days have passed and they have no new symptoms, they can come out of isolation and not to retest, because we do see this phenomenon of somebody, they test positive for COVID, 10 days later they're negative, then for some reason they test day 20 and they're positive again, and we see it flipping, going back and forth.
So David, you want to add anything?
No, similar experiences. I think we can speak all day on the reasons why that may occur. There are a ton of different variables that can contribute to that, unfortunately. But to the same sentiment, we know that PCR testing is a bit more accurate than the rapid testing, and so that's why a lot of places do reflex to PCR after the rapid. But in terms of routinely testing at regular intervals after a positive test, we recommend against that, because the levels of viral shedding, it can vary wildly. And so, apologies, it's an imperfect science, but we are working on it.
Thank you. Donella, did you have another question for the doctors this morning, or was that all from you?
That was all from me.
Okay, we go over now to GBN. Rena Pear, good morning.
Good morning. I have just maybe one or two questions to the doctors. Any one of you can answer. Focusing a little bit on vaccination and some of the reactions of the body, especially in women. We would have had some reports that some women may experience difference in their menstrual cycle. Maybe that cycle may not come after taking the first shot of the vaccine for maybe 2, 3, 4 months. Sometimes they don't see it for a good while before it comes back, and when it comes back, it's a bit different. Or some older women who might have just passed their menopause period would experience the period coming back for a short time. Is this normal when taking the vaccine?
Thank you very much. There have been some reports of women indicating abnormalities in the menstrual cycle after the vaccine, but this is temporary. It does not permanently affect the menstrual cycle. So yes, there are reports that some women say, after I took the vaccine, a month or two, the flow was different, but this is not something that's permanent. This is not something that's going to affect your fertility. It doesn't put you into menopause before your time. So this may occur, but it's a temporary change. It's not something that's permanent, that's going to affect your fertility. It's a temporary phenomenon. And again, it's not in a vast majority of people. It happens in a few. We have heard these reports, but again, we're saying it's temporary. It is not a permanent change.
So, excellent question. That is a quite common phenomenon that we see in primary care. It's called secondary amenorrhea. So that means not having your period after previously regularly having your period. It's a very common stress response. We see that often when women go under any stressful situation, really. You may find that your periods are irregular for a short period of time after the death of a family member, after a major car accident, really any external stressor. When we get the vaccination, we have a strong immune response. So that is a physical stressor. And so we have seen some instances of your periods just going a little crazy for a few months after, but by and large, that settles down very, very quickly, and it does not affect long-term fertility. It does not cause infertility. It does not interfere with that by any means. And unfortunately, I can't speak to your reports of postmenopausal bleeding because I have not heard those reports.
Rena, anything further from you?
I just wanted to ask, one doctor would have said previously in a discussion with her that it is safer for the men to get vaccinated because they would think that the vaccination, or some of the rumors would say that the vaccination would stop them from being fertile, but it is dangerous if they don't take it because the COVID-19 virus can cause that. Is that true?
Fortunately, no. The COVID vaccine does not cause female or male infertility. That has not been proven by any major reports, to my knowledge. We do see COVID virus causing infertility in some rare instances. It can affect some of the cells in the male reproductive system, but no, I am not aware of the vaccine causing male or female infertility.
Okay, thank you, Dr. David, for that response there. Before we wrap up, I see we have follow-up questions from Mikey and Callistra. If we can just take one each from you guys, and then we'll put a wrap on this morning's proceedings. Mikey, go right ahead.
Okay. I just wanted clarity from Dr. David. I know you just mentioned that the antigen test, the rapid antigen test, is less accurate than the PCR testing. I'm not too sure if you were sharing the sentiment that as well, there might be times when it's necessary to validate your antigen test by doing a PCR test. So I'm asking, would you recommend that for example, in our environment, would you recommend from time to time backing up an antigen rapid test with a PCR test?
I would say that all depends on the scenario at the time. It all depends on the setting in which the testing is happening. And sometimes that just isn't possible, unfortunately. So it really is scenario specific, unfortunately. In a perfect world, we would have PCR testing for all, but unfortunately, that just isn't financially feasible. That isn't socially feasible. And so I can't give a solid answer to that, unfortunately.
I do want to respond. I know some people have some questions and hesitancies about antigen testing, particularly when we have such a high rate of COVID-19. The test tends to perform better. Now, if you work in an environment where the rate of COVID-19 is a bit lower, maybe there may be some concerns too. But because the rate of COVID-19, unfortunately, is so high, I believe the tests are performing at a good level. We are not saying that any test is perfect, and we do agree that there are times where you may have to back it up with a PCR test. But I believe, based on the data that I've read about antigen tests, that they can provide us good information, particularly where we're in a situation in Grenada where we have high rates of COVID-19. The performance is good. Again, there are instances where you may need to back up a PCR. And even PCR themselves, sometimes you need to repeat. So we put the clinical picture into consideration with the tests that we are doing, and we come to a decision. But I just want to assure the public that we can have confidence in these rapid antigen tests here. Again, we are not saying anything is 100% perfect. We use the clinical picture, we look at the rates of COVID-19 and things like that, and then we come to a conclusion.
I agree with Dr. Alexis. To clarify, you can trust the rapid test. In some instances, you have to back it up with a PCR, but yes, you absolutely can trust the rapid antigen testing.
Yeah, do that. We do that all the time in hospitals, in nursing homes in the States. Mm-hmm. We use rapid antigen tests all the time. As recommended where I work at the California Department of Public Health, they have authorized the use of rapid antigen tests, and we are grateful that we have these tests in Grenada to help us.
Mikey, before we take the final question from Callistra, I just want to add that at the policy level here in Grenada, during the early stages of the pandemic, we focused on the use of PCR testing but you would appreciate that the rate of infection then was pretty slow. When we transitioned to community spread, and as Dr. Alexis stated, the rate increased, it was imperative that we got more immediate results to get a more accurate picture of the situation on the ground. So I just wanted to make that point. And now, Callistra, the final question of the morning to you.
Doctors, the paralysis, is that linked at all? Is that considered a vaccine injury, rare or not? I know at least one person here two people here in Grenada who have suffered paralysis. They are saying that it coincides with them taking the vaccine. So are there any instances, any incidences of paralysis, or would the at least two cases here, be merely coincidental?
Thank you very much. It's a great question. So we know with the viral vector vaccines, the Janssen vaccine and the AstraZeneca vaccine, there has been an association with Guillain-Barré syndrome, which is like weakness, pain, numbness, and paralysis. But these are not very common events. For example, I think in the European Union, I have some numbers here, 51.5 million doses were administered and about 227 cases. In the United States, 12.5 million of the Janssen vaccines and 100 cases, 100 cases. So there have been instances. Now, I don't know particularly the case that you referred to, so I can't say, oh, yes, that was related to the vaccine. It may not have been. But what we would advise if someone has an adverse effect, there is, the CDC does have what you call an online portal where you could enter your data. This is what I experienced, and it will be investigated. So I am saying that there has been some association, not very common, between the AstraZeneca Janssen vaccine and this Guillain-Barré with weakness and numbness. But not everything that we experience after vaccination is related to a vaccine. So we have to be very clear. I may take a vaccine now and then I might be getting a cramp in my knee or so. That may not necessarily be related to it. So this is what I want to be clear. Not everything we experience after is related to the vaccine. But if there is a concern, definitely the person should reach out to their provider. They can have that information also placed in there. And again, I know time is limited, but I do want to say that these rare events like Guillain-Barré or the clots that we get, for example, the clots that we get that we've heard about with the viral vector vaccines such as Janssen and AstraZeneca are significantly lower than what we get with COVID-19. The COVID-19 patients I have seen, patients with blood clots in their legs, blood clots in their lungs, young people in their 30s, 40s coming in with strokes because they got a blood clot, cutting off circulation to their brain, blood clots go into the heart. So the rate of clots with COVID-19 is significantly higher than that with that of the vaccines. And also with the Pfizer vaccine, again, there is some concern about inflammation of the heart. Again, the rate of this myocarditis, inflammation of the heart with the Pfizer vaccine, it's much lower than with the actual COVID, because with the actual COVID, the rate of getting this is about 11 to 100,000. So for every 100, let me say that again. For every 100,000 persons that get COVID, about 11 would get this situation. But with the vaccine now, it's 2.5, meaning that for every 100,000 persons that gets the vaccine, it's 2.5. So yes, we do hear these reports, but the rate, we have to weigh things. The rate is much, much less with the vaccine than with the actual disease. So we have to weigh the benefits and the risk, and the person who has this problem, they should just reach out and that the information could be put in and analyzed. It may not have anything to do with the vaccine at all.
Thank you, Dr. Alexis. It is now time for us to put a wrap on things. We have no more questions from the media. Dr. David, I'll ask you to just make some closing thoughts, comments, whatever message you would want to send to Grenadians at this time.
First of all, thank you for having me. Under the circumstances, it's always difficult, but I'm always happy to be back home, offer help in whatever way that I can. I do want to say that it is always expected and normal to be scared and to be hesitant in a time of great change, which this is for Grenada. By and large, we are the most resilient patient population I have ever come in contact with. Having practiced here in New York and Indiana, Grenadians are the most resilient, bar none. And so I do think that we will get through this. I think we can get through it quicker if we have people more willing to accept the vaccination, more willing to adhere to the protocols that the officials are putting in place right now. It is difficult. It is very, very difficult, but hopefully it will only be for a short time if we all play our part in spread mitigation. If you have any questions, if you have any hesitancy, if you have any concerns, please speak to your healthcare professionals. We're here to help. We're here to answer questions. We're here to encourage in whatever way that we can. I know that it's so easy to have access to a wealth of information with the internet always at our fingertips. But I would recommend against, the social media investigating, the Google investigating. Please come to us and we will help you decipher all the information and lead you in the right direction, which I can say with a great degree of certainty is vaccination.
Thank you, Dr. David. Dr. Alexis, your final thoughts, comments.
Thank you so very much. A pleasure to be here. I just want to encourage us to let's continue to practice. I heard Dr. Donald say that a while ago. Continue to practice, healthy habits, eating, vegetable, fruit, exercise, sunlight, water. We are not saying it's just a one-man show with the vaccine. We are saying we have to practice healthy habits so we could get our comorbidities under control. We could reduce the rate of our comorbidities. We can do the social distances and so forth and so forth. And then we have the vaccine on top of all of this to get the pandemic under control. And so this is just another plea. As physicians here, as Grenadians, as physicians of the diaspora, not just my voice, but the voice of the diaspora and physicians in the diaspora, Grenadians, this is a wonderful opportunity. We have two choices, Pfizer, AstraZeneca. Vaccination is a way out of this pandemic. And let's continue to be healthy, eat healthy, and do the other things, but we thank God for the vaccine.
Thank you very much to both doctors here this morning, Dr. Karina David and Dr. Molara Alexis. Thank you so much for your input into the weekly post-cabinet press briefing, and thank you too for your service to Grenada during this time of crisis. I trust that you will be an example to some of your other colleagues, encourage them to do what they can to help the country through this difficult time. This is where we put an end to this morning's post-cabinet press briefing. I am Press Secretary Philomena Robertson. Thank you so much for joining us, members of the media. Thank you for your weekly presence. And to our listening and viewing audience, thank you for choosing a reliable and accurate source of information. Until we see again, be safe.